Hello and welcome. I'm Ben Carden. Facebook Live. I always try to do these programs every so often to bring to the people of Maryland timely subjects. And I'm very proud today that I have two real experts in regards to COVID-19 and the impact it's having on our community to talk about the current status of COVID-19 and what we need to do as a community and what we need to do as a nation in order to deal with this deadly virus. My guests today are Beth Anne Langrell, who is the CEO for All Seasons. That's a nonprofit behavioral health clinic and rape crisis center on the eastern shore of Maryland. And Dr. Josh Sharfstein, the Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins School of Public Health, and the former Secretary of Health and Human Services for the state of Maryland, the former Deputy Commissioner of the FDA, and the former Commissioner of Health for Baltimore City. So we really have two people who are very much involved in our community, have seen direct impact of COVID-19, and can help us sort out where we are now and what we should expect moving forward. Dr. Sharfstein, I'm going to start with you. Thank you so much for your public service. You've done incredible things in our community. I want to talk first about Johns Hopkins. Every night when I'm watching cable news, I've seen the numbers come up on the screen, and the source is Johns Hopkins. Tell us how Johns Hopkins, which we looked at as a great institution here in our community, how it developed the role of being the international go-to source for this type of information about how many cases are out there and how many deaths.
Sure. Thank you so much. And thanks for having me, Senator Cardin. And thanks for all your leadership and work to support the country during this time and get resources for all kinds of critical response activities. It's extremely important. And we're extremely lucky to have you in Maryland. So, Johns Hopkins School of Public Health is the oldest in the country. It actually got its start right in the middle of the last pandemic, the big great influenza. And here we are 100 years later, and the university has mobilized again. And it started with exactly what you're talking about, the map that Professor Lauren Gardner put together with some of her graduate students to track every case as it was reported around the world. And it was really the first comprehensive effort anywhere to do that, better than any of the government sources. And it has continued not only to contain tremendous data. One of her principles getting started was that all the data should be freely accessible. So she made it very easy for people to download. So there are millions and millions of hits to that map, but behind the scenes, there are billions of times people are actually downloading the data to be able to analyze it for their own purposes. And with a whole team that's come together, Beth Flower, Lainey Rutko, and others, they've built out all of the, Jennifer Nuzzo, all of these other tools on the website. And that's all at coronavirus.jhu.edu. But you can see the trends in testing, the trends by state, the international trends, which countries are having more problems or less problems, and all sorts of analysis. You can also get the daily report from the Center for Health Security, which is the leading organization, academic organization on pandemic preparedness and response in the world. They've, have been enormously influential through their reports at both the state, national, and global level. And you can hear about the treatment side. Johns Hopkins Medicine has done a tremendous amount in terms of research. They've been leading in some of the plasma research and other major studies. And we have a podcast that's been downloaded almost 3 million times where we interview people all around campus who talk about their work. So it's both understanding the virus, responding to it, the data, and also the, all the elements of the public health response.
Well, I can tell you just how useful it is. Your information has been used by the state of Maryland in this plan as to how to keep the people of our state safe. It's been used by the United States Congress in planning what we can do in order to help deal with the COVID-19 response. And it is very much a tool being used in the international community. I have been in contact with my colleagues around the world as we talk about COVID-19. And it's your information that is the common thread, the common material we're using in order to try to deal with a global response of COVID-19. So just great work, and we thank you for that contribution to not just our local public health, but to the science for the right public health globally to deal with this pandemic. If I could, Beth Anne, if I could come to your services, and let me just preface this by saying, in March of this year, the Congress came together with a bipartisan bill, the CARES Act. It was a very comprehensive bill, trillions of dollars of help to try to deal with this pandemic. Now, when we passed the CARES Act in March, we thought this pandemic would last for several months, but we didn't anticipate it being still with us. And we provided substantial resources for healthcare providers to deal with the direct cost of COVID-19. And we recognized it would have some other impacts on related type of health services, such as mental health addiction, but we didn't anticipate it would be a long-standing challenge. And certain funds were provided, but most of those funds have now been exhausted. Can you just share with us what you're seeing on the Eastern Shore in regards to challenges families have had as a result of our communities not interacting the way it normally interacts before COVID-19?
Yeah, absolutely. I think that one of the things that we are seeing, we are seeing it across the state. It's not just in our Eastern Shore community, but there is a definite shift in the amount of depression and anxiety that people are reporting. We're dealing with something where you are forced into isolation. We have seen loss within our community. Before we came on to do the broadcast, we talked about even the loss of, our freshman college students experiencing orientation. Our seniors have lost their ability to celebrate the prom. Small little things that meant a lot to all of us as community members growing up have shifted. And what seemed to be a short-term, let's get through this, in the spring, especially for our children who are home through doing virtual school, we now know that this is an unknown time. And so we've definitely seen an uptick in support needed for folks who are facing unemployment, for people who are managing schedules differently. Maybe it's a working from home parent while managing our virtual schools. We've seen an increase in anxiety because folks are struggling in the unknown. We are a human race that wants beginnings and ends. We want to know when summer vacation starts and when it ends. And right now, we're in a time where what is true to be today and what the outlook looks today can shift within 24 hours. And so sort of managing that unknown and the space of unknown is difficult for us as adults. And when we look at our children population, it's really difficult for the children who might A, not understand what's happening, but B, not be able to wrap their heads around the fact that so many things are changing in a difficult course. And so I can speak for our agency alone on the Eastern Shore that since March 1st, we've seen over 700 new patients come through our doors, seeking what might be short-term crisis or long-term services. We specifically have created what is called a COVID appointment. We've always held urgent care appointments and crisis appointments for folks that are struggling with suicidal thoughts or in extreme crisis. But we knew as an agency, as time charged on, that people were feeling things differently. Even if we all were at the pristine mental health condition, we are all experiencing something different during this time. And so we created these COVID appointments for folks who just are saying, I need to talk. I need to figure this out. I don't know what to do with these extra emotions that I'm feeling, or trying to help children through a situation where a parent might already be stressed, or the loss of a loved one where you can't go to a funeral. There's so many different elements that have been experienced through COVID and will continue to be experienced. And so we're definitely seeing an increase in people reaching out for help and people needing assistance.
So let me just comment on mental health and addiction. I want to go back to pre-COVID. And to me, one of the great accomplishments in recent times was the inclusion of mental health and addiction as an essential health benefit under the Affordable Care Act, so that whatever healthcare plan you have, whatever insurance company you're insured by, or whether you're under a government plan, you are covered for the mental health and addiction. There's certainly gaps in our system, I recognize that, but we did expand the coverage, and that allowed us to have much more available services throughout our community because of that change. In addition, in the CARES Act, we extended telehealth, particularly for mental health services, and we're trying to make that a more permanent change. So we are trying to deal with these issues, recognizing that you've got to have timely intervention and you have to be able to know that you can afford the coverage. So we recognize that there is never enough reimbursement money to do everything you're trying to do, and you have to rely upon your own resources. Believe me, we understand that. But we are trying to make it easier for you to be able to provide these services. But I can only imagine in a pandemic when people are not as focused on their community giving as they might be, and they have their own stresses as far as their own financial needs are concerned, that it's got to be very challenging, particularly in a rural part of our state, to be able to maintain the service level with increased demands.
Yeah, and I can tell you, Senator Cardin, that shift to being able to provide telehealth for our mental health services and additional, the other piece that has been enacted through all of the work that you've done across the state with the rest of our legislative team and our senators is also being able to provide telephone services, and telephonic services have been crucial to folks who might not have internet or who are having internet trouble. Just that continued ability to do the check-in with people. Our entire agency had to shift its mode of delivering services, but we're only able to do that with the support of things like the CARES Act and the different regulations that are shifting. Our way of business has changed, and the way of people needing services has changed. Our way of working has changed. Everything continues to shift. And so, from our agency's standpoint, we just held a leadership meeting today, and I said to my staff, nimble is the word of the year. We've got to be nimble. We've got to be able to flip on a dime to be able to meet the needs of the community. And whether it is someone who's in an urban area or a rural area, those shifts for our telehealth services have made all the difference in the world to keep people connected in a very disconnected time.
Well, thank you for that. Telehealth, expansion of telehealth services is one of our highest priorities in advancement on our healthcare system. And we hope to get some additional help in regards to the next round of COVID relief, but we're also looking at permanent legislation dealing with telehealth so that we can be more nimble and we can reflect particularly access where people just don't have the time to be able to travel long distance, make plans, it's timely intervention, et cetera. Telehealth can provide a lifeline for services. So thank you for what you're doing on the Eastern Shore. Josh, I want to get back to you for a moment as to where we are. Yesterday's numbers that I saw for Maryland, 616 new cases, 7 deaths as a result of COVID-19. As of today, we're nearing 9 million infections in our nation with over 225,000 deaths. In Maryland, our daily new infections are running between 500 and 1,000. That's per day. So we were told that we want to get rid of the first wave so that the second wave wouldn't be quite as severe as the colder months approached. Are we still in this first wave? Did we ever get the first wave under control? And where are we in regards to the increasing number of cases that we're seeing today?
Sure. Well, those numbers are obviously concerning. They're not as bad as some parts of the country. I mean, we're certainly seeing in the Midwest just absolutely explosive growth of cases. We're seeing in many places emergency hospitals needing to be built, or military hospitals being commissioned for use, or patients being helicoptered to other places because there are just so many sick patients. We're not seeing that yet in Maryland. I think what happened was we had an initial surge, we got over the hump, and it came down, but it didn't go all the way down in Maryland. It went sort of, down to the point where it was simmering, still simmering. And what we're seeing now is it's starting to boil again. And hopefully we can keep it lower, we can lower the temperature, and we don't see that out of control growth that they're seeing in Wisconsin and Iowa and the Dakotas and other places like that. But we are vulnerable. Every place is vulnerable. And I think what's going to be necessary is for people to realize that as much as we want to go back to our lives pre-COVID, we have at least a few more months of sticking this out until we can really start getting relief from a vaccine and other kinds of solutions. And we're going to have to continue to, wear masks when we're going out, keep distance from other people, not go to parties indoors, not have the usual holiday festivities with a ton of people, because that can really put people at risk. And it's unfortunate, but if we can stay vigilant for a few more months, we're going to really start to see the clouds part.
So let's talk about staying vigilant. Mark Meadows, the chief of staff for President Trump, said we're not going to control the pandemic. Other individuals in the Trump administration contradicted that by saying we have to learn how to live with the pandemic, but we need to be able to control it. So, and you're saying we need to be attentive for the next several months in order to get this pandemic under control. So we have schools that are trying to open. We have businesses that are desperate to open. We have people who just are really anxious to get out. Tell me, what should we be doing in regards to businesses, as regards to schools? I understand that we should be wearing masks. That should be a no-brainer. We should be distancing. That also is something we understand. We need to practice personal hygiene as far as washing our hands, etc. Understand all that. But what recommendation would you have in order for us to be able to get this virus under control?
Sure. So I have certainly recommendations for individuals, but also recommendations for policy and for investments to support what individuals can do. So, for individuals, I think it's important to think a little bit like the virus. The virus just loves to jump from person to person, and it can hide even when people don't have symptoms. So if you're putting yourself in a position where you're around a lot of other people, particularly without masks and particularly indoors, that is what the virus is excited for. And so if somebody says, like, come over to our house, we have a whole bunch of people watching the game, you have to think, like, the virus would like me to go because that virus could pass around there. And people avoiding those scenarios, figuring out ways to be on the phone during the game or do other things, that's going to keep you safe and it's going to keep other people safe. So it's really that new normal of not doing things that just would make the virus really happy to be able to transmit. Now, that means some policy implications too. I think there's certain things that are just too easy for the virus to spread. Having a 500-person wedding indoors is too much. It's just like rolling out the red carpet for the virus. There's certain types of events that are just going to be too dangerous, and we have to understand that those will come back, but they'll come back when they're much safer. We need to prioritize opening schools and figuring out how to do that, because kids can really suffer when they're not able to be around their friends and teachers. But in order to do that, we have to take actions in our own lives to reduce the spread in the community. And we also need to invest in support so that schools can be open more safely. And that may mean more people to teach the students, smaller classes, room for, money for masks and hand sanitizer, and other kinds of things to support a safe way of opening schools, money for testing. And so I think it's very important, and I know that you're supportive of this, and I know the House of Representatives has passed legislation to really support the kind of activities that we need. And I also believe those businesses that will close down because they can't, have a 500-person wedding, I think they should get support. I think their employees should get support. We have to invest in the kinds of things that make it possible for us to fight the virus, but do the things we need to do, like send kids to school. And that's where, I'm very, hopeful that at some point we'll see legislation that moves through Congress. I know it's passed the House, that would really provide funds for states and localities to get school going again and to support the businesses that can't work in a pandemic era the way they could before.
I'm going to come back very shortly to what Congress can do, but first, Beth, I would like to get your observations on what you see in your community. You have essential work to do. services that you are providing, the health services are critically important to the people of your community. You have essential workers that have to work and run a higher risk of getting the virus. Tell us how you see us containing the virus, but still being able to service our community to make sure we keep people healthy on their mental health needs.
Sure. And I think it just goes right off of what Dr. Sharfstein just talked about. I think it becomes that this isn't just about us as individuals, this is about us as a community. And so really being mindful of how folks are spending their time, who they're spending their time with. Things like our children being able to have one or two children that they're playing with versus going to a whole group, making sure that kids are wearing masks, adults are wearing masks. It's really easy in a time right now where things seem to be getting better, where everybody can let their guard down. But one of the things that we are really diligent about at our agency is making sure that we're doing those temperature checks and that folks are wearing masks and that our staff is thinking beyond just the day-to-day work, that time off of work is just as important as time in work. Our agency has remained open this entire pandemic because we are essential workers. We've done both telehealth and in person. And so the health of our community relies on our staff being diligent and all of the staff that are essential workers, from our first responders to the hospital workers, to make sure that we are maintaining a safe environment for folks who are really suffering in different ways right now. We know that people are reaching out differently. We know that, our job right now is to keep people healthy. We have not seen the effects of the mental health crisis of COVID-19. We have seen a shift in mental health needs, but when the virus goes away, there are still going to be folks who have experienced a different level of trauma, a different level of isolation, maybe increased substance use, someone who never thought that they had a depression or anxiety disorder before. Everyone's experiencing different symptoms. So even if there's not a diagnosis that's attached to what's happening for individuals or for families, this is something that's not going to go away when there's a vaccine, or not going to go away when we know that we're moving towards reopening in a full capacity. The effects on our children are going to continue to remain here. We've done a lot of outreach in our community specifically on helping parents understand how to support children. We know that this is a time where resiliency is going to be really important. And the unfortunate piece for our children is that they haven't had the skills built yet for, some of our 8 and 9-year-olds who don't really understand what resiliency looks like. At the same time, we know that this is not the worst experience they're going to have in their life. So there's a really good opportunity for us as parents and as teachers and folks in the community to support our young people. But at the same time, we also have to be really mindful of taking care of one another and providing self-care through responsibility, and making sure that we're making the best decisions possible on behalf of our children, our families, and our neighbors. And that's a piece where you don't have to agree with the neighbor next door. You don't have to necessarily have the same views as them. But if we can all collectively come together from a place of, my responsibility is to take care of you and your responsibility is to take care of me, it's going to be a much better result as we move through this pandemic, as the numbers go up and down.
Thank you for that answer. I think both of you have really pointed out that we all have responsibilities in controlling this virus as to how we make our choices and decisions. Yes, it's disappointing we can't tailgate for a football game. I recognize that we can't do that, but that's a relatively minor sacrifice to containing the spread of the virus. So we got to make smart decisions. I always enjoy Dr. Fauci when he gives examples of whether you should go on a plane to do this or that. You got to evaluate, and there are ways that you can minimize risk, and you've already talked about a lot of those issues. And then there's common sense things such as wearing a mask and social distancing, which you should do it for yourself, but also do it for our community. And we all do it, we're all going to be better off. But both of you also alluded to the fact that there are additional burdens that only government can help with. And we have a model for a government response. We did that with the CARES Act. I'm so proud that that passed the United States Senate on a unanimous vote. This is a couple $1 trillion program that passed with not 1.3 or 1.4 trillion that passed with a unanimous vote of the Congress, and it provided real help to state and local government, real help to healthcare providers, real help to American families, real help to those who are unemployed, to small businesses, to large businesses, and the list goes on and on and on. It was comprehensive. Now, that bill was passed with the assumption that the pandemic would have a major impact on our economy for a couple months and American families for a couple months. But then we would be coming back to some degree of normalcy. Well, obviously, that's not what happened. This pandemic is going to be with us for a long time. It's going to have an impact on us for a long time. So, Josh, you mentioned a good point. You said these businesses need help. I'm the ranking Democrat, that is the senior Democrat on the Small Business and Entrepreneurship Committee, and I'm one of the architects of the programs that have helped small businesses, along with Senator Rubio, the Republican chair. I'm the Democratic ranking member. And we did provide particular programs to help small businesses, and they did work, and they did provide help, and they kept people employed, and they kept businesses open and safe. But it was limited duration, and they need more help. The challenge is that if we just provide direct help to small businesses and we don't deal with the needs in our schools, and Beth, you pointed that out, that to be in a school safely today is going to be smaller numbers, more personal protection, more spacing, more barriers, all those things. Plus, we have to deal with hybrid education, with the digital divide and those who do not have the same access to the technology. And then we have to deal with communities that can't have in-classroom instruction. All that needs to be in the equation, which costs resources. And if we don't provide that, business owners are not going to get the customers they need. And if the community does not believe it's safe to go out because we haven't contained the virus, we're not going to get our economy back on track. It's just my own point. I wanted to point out we need a comprehensive response. And I am disappointed we didn't pass it before the elections. I hope that when we return on November the 9th, it will be the first order of business and we can pass a comprehensive COVID relief package. I know that Speaker Pelosi and Secretary Mnuchin on behalf of the Trump administration are negotiating that package, and I've encouraged them to reach an agreement as soon as possible. I want to go on to another subject, but first let me just acknowledge that we're very pleased to have Dr. Josh Sharfstein, who's the Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins School of Public Health, and Beth Anne Langrell, who is the CEO for All Seasons, a nonprofit behavioral health clinic and rape crisis center on the Eastern Shore of Maryland, and recently appointed to the Maryland Commission on Women. Congratulations on that appointment.
Thank you.
Good news travels quickly.
Well, I am honored to serve, and it's been a real joy to be a part of the Women's Commission, and I look forward to my tenure as I move forward.
Great. So let's talk about our community, Maryland, versus the rest of the nation, versus the rest of the world. How are we doing? And can you operate in vacuum to what's happening around the rest of the nation or the rest of the world? Josh?
So I think there are some things that Maryland has done pretty well. I think the governor convened experts right at the beginning, closed, a number of businesses, told everybody to wait at home while we figured out what was going on. And that really had the effect of saving a lot of lives right at the beginning. And then he put forward a framework that was supported by his scientific advisors to slowly reopen the state so that we could, keep infections really, really low. I think there was a certain point where they stopped following the framework that had been put out and actually, didn't listen to the advisors completely. And so things opened up a little bit quicker than that framework would have indicated. And I think as a result for that, we didn't really get the cases down as low as could have been done. And I think the other challenge that I know is that there's been not the greatest coordination between the state and counties. So the counties are sort of learning what the state is proposing when it's being proposed, or when changes are being made. So I don't think we're maybe the best example of a state that has the coordination between the local and state level and has really listened to the best advice on how to slowly open. And I think for that reason, we're kind of in this middle state. We're not nearly as bad as a number of states in terms of COVID, but we're at risk for starting to boil again. And we're really going to have to come together, I think, in Maryland to avoid the situation that we're seeing in other parts of the country. I will say that there's been tremendous work done in parts of Maryland. I'll just say in Baltimore, I think if we were starting this pandemic and we were just looking at it, we'd say, well, which cities are really at risk for a huge coronavirus outbreak? Most people would have put Baltimore on that list. This is a virus that really exploits inequality. It exploits poverty. We think about the cities like Detroit and New Orleans that got hit very hard early. Baltimore's never been on any of those lists. Now you might say, well, maybe that was just luck, but from speaking from Baltimore, I don't think it was. Baltimore really came together, and there was a public-private partnership that was developed by the city in coordination with the state. And you had Hopkins, University of Maryland, Care First, and others pouring in resources and deploying them in ways that were quite creative. We have, for example, a hotel where people can go if they can't be safe at home to isolate or quarantine. We have a field hospital for discharges from the hospital, so to keep beds open. All that was done in a really coordinated way. And I give a lot of credit to the mayor and to Letitia Jaraza, the health commissioner. I'll tell you, one of the other things they did was they raised over $10 million to create a community health core of people to do contact tracing and linking people to assistance like food and housing that makes it possible for people to isolate and quarantine. And that, I think, is a really interesting model. And finally, I'll just say on the mental health issue, there are like dozens of volunteers, maybe hundreds, I think, past 100, calling thousands of older adults in Baltimore City who are lonely, trying to reduce that social isolation. And that keeps them comfortable staying at home and not wandering around and putting themselves at risk. So, I don't think Baltimore is out of the woods. I think the cases are going up, but I think you can pause and look over our shoulder and say, there are some things that have happened in Maryland that are quite remarkable, and we should be proud of, even in the midst of all this pain and suffering.
And I appreciate you mentioning that, and Beth did the same when saying we look after our fellow beings, and a lot of us have really gone to extremes to make sure we keep people safe. Beth, have you had an opportunity to talk to your counterparts around Maryland, around the nation, to see how we're doing compared to the rest of the nation?
Yeah, I mean, I think when I speak with colleagues, even across the state and especially colleagues across the nation, I think one of the things that is a core piece of how we are responding is continuing to put models in place that encourage people to reach out to one another. Our own agency has a suicide prevention campaign that we launched as a part of COVID called Ask, Listen, and Share. And it's really the initiative to help people ask others how they're doing, stick around to listen, really listen to what people are needing and what resources are needed, and then share those resources in the community. I think we've seen a large uptick in people coming together and collaborating. I know especially for the domestic violence and the sexual assault populations, along with our mental health agencies, really coming together, making sure that we're distributing information in different ways. As we've come through the pandemic and things have started to open back up for our agency, specifically on the shore, a number of us came together and placed stickers on pizza boxes to make sure that resources were available for people. It's really having to be creative as we're going through some of the reopening and the shifting back, and really coming together. And I know I sit on our Talbot County COVID response team, and our health officer, Dr. Frida Wadley, has done an amazing job of really saying, here's the information, let's put a plan in place that really serves the community best, and really helping to encourage folks to do a slow and steady wins the race, and continuing to pull back and have grace in the middle of all of it. I think for for you as our senator and for Dr. Sharfstein, in all the work that we're doing, we have to have the grace to know that there's probably 80% of the decisions that are being made, we're not going to have all the information on. And so trusting that, everyone's doing the best that they can, and we're not going to always get it right. We are learning, as Dr. Sharfstein said, there are things that are coming down the pike the day of, and it's rolled out the day of. And so understanding that there may be times where decisions are being made that we may or may not agree with, but that everyone is doing the very best that they can with the information that's in front of them. And while we all could sit in our homes and say, well, it should have been done X, Y, or Z way, we also know that it's okay to take that step back and say, I believe that there's a better plan in place and people are doing the best they can with the information that they have.
Well, thank you. I want to turn to Dr. Sharfstein for a moment. Just recently, the members of Congress were briefed by the National Institutes of Health in regards to what we know and don't know about COVID-19. And we certainly know a lot more today than we did last February when this disease first became apparent in our country. But one of the frightening matters that were brought to our attention is that we really don't know the long-term impact of someone who suffered from COVID-19 as to what impact it may have on their future health. That there is some evidence, not in all cases for sure, but there is some evidence that there could be some damage to organs caused by COVID-19 that is not apparent when the symptoms ultimately are resolved. And then we do know that that older people and those with compromised health are more likely to have severe symptoms or death than younger people. But we also know that younger people spread the disease. And we know that the fastest growing increase in virus rates are among younger people. So putting that all together, I want to turn to the doctor for one moment. It seems to me that we can't take comfort in the fact that young people who get the virus are more likely to recover sooner, have less severe symptoms, but we really don't know the longer term impact of this virus. At least there's still a lot of unknown.
It's absolutely correct that there's a lot of unknown. And it's also true that overall, younger people are much less likely to get severely ill or die. But that doesn't mean for any one individual that it's likely to be, you're guaranteed not to have that big a problem. In fact, there are many younger people who have been hospitalized and some who have even died. And among young children, while getting directly sick with the virus is quite rare, there is this condition of an immune reaction afterwards that can be quite serious and has even led to the death of some children. So, this is not a disease that I would recommend anyone to get. Now, you might say that's kind of a silly thing to say. Why would you recommend that people get the disease? But in fact, there are people out there, including some people in the White House, who think it is a good thing for a lot of people to get sick if you're in a group that overall, is unlikely to get very sick. But there are two problems with that. One problem is that those people actually could get sick. So it's a recommendation for you to go out and get sick, but you yourself could get quite sick no matter what your age is. So that's number one. Number two is you could pass it on to somebody else who is at very high risk. And in fact, that's what we're seeing in places where younger people are getting infected. A week or two later, you start to see older people get infected with more deaths. And then there's the third issue that you just mentioned, that we don't really know the long-term effects. Now, you can go overboard in worrying about every possible long-term effect, but we do know that there are some impacts on the heart. We don't know how long they're going to last. We know that there's some people who have symptoms, even if they weren't that sick. At the beginning, they have symptoms that last for a long time. And there's now evidence that some people elicit an antibody response that attacks their own body. They get COVID, but they wind up with what looks like autoimmune disease afterwards. This has been a very deceptive virus. I interviewed for our podcast a hematologist, Robert Brodsky at Johns Hopkins, and he talked about how the virus can interrupt clotting and how it can cause heart attacks and strokes. So, there are a lot of reasons to protect yourself and the people around you from this virus. And this issue you're raising of the potential long-term consequences is definitely one of them. We want to have as few people as possible get sick. And, until we can get to a point where we can get a vaccine and avoid potentially, a whole bunch of consequences that could come down the line.
And you had mentioned earlier about mixed messages coming out from the state, but we've clearly had, in some cases, the wrong message, but to be kind right now, mixed messages coming out of the White House and the federal government, and certainly not clear direction to how protocols should be implemented. And when they issued protocols, they didn't stick to the protocols. So we've had that inconsistent messaging. But what really worries me, it seems like there is a message coming out that if you're older, you should exercise some judgment here before you go into crowds. But if you're younger, what's the big risk? And I think what you said, Dr. Sharfstein, the big risk is that you'll get this disease. It could very much impact your health now or in the future. And then you are spreading the disease to others in our community, and we're not getting it under control. And there's liable to be a statistically significant amount of serious illness and death as a result of the spread of this disease.
Yeah, that's absolutely right. And if I could just throw in one other thing, I recently did an interview with a group at Johns Hopkins that's working in more than 20 countries around the world about messaging, public messaging on the coronavirus. And they said in many countries, one of the messages that resonates the best is they do advertisements of people saying, I don't want to be the cause of pain in my family. So it's younger people, and they say, I don't want to cause my family pain and suffering and death. That's a message that in some countries has been actually very, very important. And those countries have really avoided some of the problems that we've had in the United States with people really staying vigilant.
So let's get back to mental health for one moment, as to how that impacts when people get sick or feel guilty about other people getting sick. It does put additional pressure on a person's mental health status. And we also now have the flu season. And there will be some degree of confusion as to whether we have the seasonal flu or we have the coronavirus. Tell me how you think this all will interact in regards to what you expect to see this winter on the Eastern Shore of Maryland from the flu and coronavirus as to trying to keep people healthy on the Eastern Shore.
Yeah, I think it, a little bit resonates back to what Dr. Sharfstein just said. I know even from our agency standpoint, when you talk about those messages in those other countries that you don't want to be the person that is responsible for your family getting sick, it's had to shift a lot of the mentality, even with fundraising and with any events that we would be doing for our agency. We don't want to be that group that gets the community sick. And so I think as we look towards flu season and as we look towards the coronavirus numbers going up, and knowing that in certain areas of the Eastern Shore right now, there are hotspots that are sitting within our area, it really becomes a point of being able to help folks manage what is controllable in front of you. We know that you can control putting a mask on, you can control the number of activities that you are participating in. But, one of the messages that we had even this week across our county was really be mindful, where you might have sort of haphazardly said, oh, I've got the sniffles, or I really don't feel good, but I'm going to charge through and I'm going to go to work. It's about thinking a little bit differently and figuring out how you're going to show up for your community. So if you don't feel well, don't be a champion. Work is going to be there. You can work from home now. Our job right now is to keep our community safe so our children can continue to go to school. If your child is sick, while it might be the easy thing to send them to school and hope that they feel better by the end of the day, we have to think a little bit differently right now and really think ahead of what the day might bring. And it also requires us in this season to be a little bit more diligent. And, you mentioned earlier, Senator Cardin, the difference in what holidays are going to look like. It is tough, and it is really difficult for people who are already feeling disconnected, who are feeling depression and anxiety, and just want to be with family. But we need to be a little bit creative with how we are thinking about reaching into our families and how we spend our holidays, so that in the end, we'll be able to have a big holiday gathering again. And I know especially within our Eastern Shore community, that's requiring us to do a little bit different outreach to our folks. Our agency serves both our Spanish and English speaking populations. And so we are really having to do messaging differently and to just continue to make people aware that as the colder months come into our region, we have to be mindful of the number of indoor events that happen and really saying, it might have been okay to go socially distance for a walk outside now, but going indoors is going to make that different. And so really helping folks be mindful of through this season, how are you going to do some self-care for yourself, continue to keep yourself active, but also not put yourself at risk and continue to work so that our business community and our schools can continue to thrive in a time where it's really difficult.
Yeah, absolutely. Absolutely right. Thanks for that message. So explain to me what is the concern about the flu season with COVID-19? I understand people being indoors, the COVID-19 will spread more easily. I just want to make it clear, I've gotten my flu shot for the season, recommended by my doctor. I get it every year, and I made sure I got it timely. But what is the concern in regards to the flu season coinciding with an increase in COVID-19 infection? Josh?
Am I on mute there?
Yeah,
Sorry.
there you go.
The main concern is that, in a regular flu season, we see a lot of people get sick and actually, a good number of people die. Not anything like we're seeing now with COVID, but still too many people. And right now we're worried that if the hospital needs to have capacity for COVID, that if the hospital is filled with flu patients, there won't be enough beds in the hospital to take care of people. That's really the number one concern, that it will overwhelm the healthcare system to have flu and COVID happening at the same time. And so the solution are twofold. First, to get the vaccine, just like you did, which is good. But the other thing is following all those good practices for COVID, like wearing a mask and keeping distance and washing hands. Those are great for the flu. So what we've seen in the Southern Hemisphere, because it was their winter during our summer, is that they had very mild flu seasons in the places where they were really taking a lot of precautions against COVID. So hopefully we'll be in a situation where we come together, we remain vigilant, we get the flu shot, we stay distant, we don't go to these big parties, we think about where the virus wants us to go and we stay away from that. And then we're going to have much less of a flu problem and we'll be okay this year. We want to avoid the situation where we're so tired of putting up with any kind of restrictions that we go back out, we start, getting exposed not just to COVID, but also to flu. People get extremely sick and they get sick from both things. And we really wind up with a crisis for our healthcare system come December or January.
So we have a couple questions from our audience on Facebook Live. So let me try to get to a couple of these questions. One deals with the fact that in the minority community, we have a much higher numbers percentage-wise with the infection and those that die. In Maryland, I believe the number of deaths related to COVID-19 is around 40%, whereas the population is around 30%. So the question is, why is that, and what can we do to make sure there's outreach to the minority community to take the steps that are necessary and have the resources they need in order to protect themselves from this virus?
So that's a great question. Let me just point out that those statistics which you cited, which are generally right, only show the beginning of the problem because it doesn't adjust for the age distributions, and it doesn't adjust for the fact that in minority communities, people are getting sick and dying much younger. So the problem is even worse. And at the national level, for example, African American and Latino populations are well more than 3 times more likely to die. So it's a huge, huge problem, and it's really important both for diverse communities and low-income communities to get the information they need, but also to get resources to support them because it's both about being able to keep distance, but also having enough financial support that you don't have to go out and put yourself in harm's way. It's about getting support for having a safe job and sick leave so that if you're sick, you're not going out and getting exposed, or your coworker is not going out and exposing you. So there's a lot that needs to happen. I think in Baltimore, one aspect of the public-private partnership that I was talking about was a lot of intense communications and different kinds of resources that have been mobilized. Enormous amounts of food the city's been able to distribute so that people don't have to put themselves at risk to try to figure out how to get food or work, if they're sick. In addition, there have been a lot of communication efforts in different places, and the political leaders have been very consistent across the board, even when they were running for election against each other, about getting really good messages out all across the city. But I do think it's really important as we look ahead to the vaccine. It's going to be extremely important for people to have confidence in the vaccine, including in communities where that have been betrayed by medicine over the years and decades, to realize that this is a vaccine that's been tested on people of their own background, and that it is safe and effective. That's what we hope. And if it gets to that point, it's really important for people to understand that and to be able to ask questions, get their questions answered, and be ready to get vaccinated, because that ultimately could really help us turn the corner.
I want to get to the vaccines because we have a question from Laurie on Facebook that deals with that. But before I do, Beth, your organization, For All Seasons, has a reputation of serving all communities, particularly the underserved communities. Has that been made more challenging as a result of the number of minorities that have been impacted by COVID-19?
We certainly have had to shift a lot of the work that we've been doing, and it's forced us to sort of reinvent ourselves as an agency. And I think I speak for all of my partners across the state that we've had to reach in differently. You know, when we are trying to reach our minority communities who may not have access to the normal services, it's required us to do more radio shows. It's required us to put billboards up on Route 50 that we normally would not have put up, making sure, talking about the food distribution. That's been a huge avenue for us to reach our underserved population. So we make sure that we have our brochures and information about services. We're working very closely with our Department of Social Services to be able to think of creative ways to create inroads to the folks who we can't serve. And that sort of comes back to what we talked about in the very beginning, is the telehealth and the telephonic services. That's been critical for us. Our agency has also, we have a 24-hour English and a 24-hour Spanish hotline, and we've also created a text line. So we know that some folks who might be in crisis might not be comfortable making a phone call, but they may be able to send a text and say, I need services. Our mobile crisis team, we have the Sante mobile crisis team on the shore. They are phenomenal in the services that they provide, and it's partnering with law enforcement, with our crisis intervention team through law enforcement to make sure that folks are getting the services that they need, and certainly being able to then work with our school systems to make sure that our children are supported, with our local healthcare providers, and especially within our nursing homes, to make sure that, we've got such a large population of our seniors that have essentially been kind of in a lock-in situation in their homes because we are trying to contain the virus. And so making sure that those seniors that can't come out of their homes, or that are asked to staying in a same location in our nursing homes, that we're able to also reach out to that community. And that requires sending different modes of transportation to those folks, as well as communication.
So essential workers, if we look at the percentage of minority in our essential workers, it's higher than the average and then the demographic numbers. So Laurie's question, I think, is right on target. How long do you think it will take to vaccinate healthcare workers, especially those of us who work in nursing homes and retirement communities? Josh, I want to expand that. When do you think we'll start to see the vaccine actually be available? And how is that distribution done when we recognize it's going to take a significant amount of time to get the distribution of vaccines to the general public, et cetera? How are those decisions made? And if you could answer Laurie's question, I would appreciate that.
Sure. Sure. So right now we're in a stage where we're getting the data to find out whether the vaccines are safe and effective to use. And those studies have been going on. There are tens of thousands of people involved in those studies. And we should be getting the results from them later in November or December, at least for the first studies. But probably by January or February, we'll have as many as 4 studies to look at to see whether those 4 vaccines are safe and effective. And when one of them is safe and effective, then it will be given an authorization to be used. Now, the companies have started making the vaccine now as if they knew it was already safe and effective. They don't want to have to wait for the result and then just start to make the vaccine. They're doing it anyway. We're paying for it as taxpayers, but it's a good investment. So if it turns out it's not a safe and effective vaccine, they just throw out the vaccine that they made, and all we've lost is a little bit of money. But if it is safe and effective, we're going to already have a certain number of doses. I think for one of the vaccines, they think by the end of the year, they may have 10 million doses. So that gives enough doses to start to vaccinate both healthcare workers and very high-risk individuals. And there's starting to be a plan for that at the federal and state level for how to do that. Now, if you have a safe and effective vaccine, they've already made 10 million doses. They're going to try to make as many doses as they can. Depending on how many of those 4 actually are safe and effective, we could have 4 vaccines, 4 companies making as much as they can. And so the hope is by mid-2021, there would be enough vaccine for everyone in the country. But coming back to the end of this year, we just have maybe 10 million doses or so for assuming it's safe and effective, for healthcare workers and people at the super high level of risk. So how will they do it? What they'll do is that the federal government has set up a program to distribute the vaccine. It will go directly to places that the state of Maryland tells them where to deliver it. And along with the vaccine comes syringes and other things like that. For long-term care facilities, like the question here, nursing homes particularly, there's a partnership with 2 pharmacies, I think it's CVS and Walgreens, where they will send people out with the vaccine in order to vaccinate people there, which is a good thing to do. One of the challenges is that I think 3 of the 4 vaccines have to be kept at a super cold temperature. So you just can't take it in a little cooler. It has to be at this special kind of cooler. So the supply chain, as they call it, how the vaccine moves, becomes very important. So there'll be an approach for nursing homes. There'll be an approach for hospitals. Hospitals will be able to get their staff vaccinated. And then depending on how much extra vaccine there is, probably the health department will set up who else can be vaccinated, whether it's going to be in senior retirement communities, or maybe it will be in senior housing developments. There are other kinds of places. That is really what Maryland is thinking about right now. And recently, Maryland presented its initial plan for what it would do. And basically, that plan has very much the idea of nursing homes, but beyond nursing homes, there are not a lot of specifics in there. And I think that's probably what they're building out. So the solution, the answer is, I feel pretty confident that once a vaccine is made available, it will get to hospitals and nursing homes fairly quickly. Beyond that, I think it'll depend on how much there is and what the state's plan is.
Well, thank you for that answer. And of course, everything depends upon the success of the studies. All indications are encouraging that we should have more than one vaccine that'll be available by early 2021. And the distribution will be done with priorities to the healthcare workers and those at the highest risk. But we do hope to get the overwhelming majority of Americans access to the vaccine as rapidly as possible. Certainly during 2021, we hope to be able to get those vaccines out. A large part of this will be an education campaign so people know the facts about the vaccines, and those who should be vaccinated have confidence to in fact become vaccinated, because we know we always get some resistance to being vaccinated. So that's going to take a public education campaign, and one that we need to be prepared to deal with. Let me thank both of my guests today. This has been an extremely helpful conversation on COVID-19. I want to thank Beth Anne Langrell, who is the CEO for All Seasons, which is a nonprofit behavioral health clinic and rape crisis center on the Eastern Shore of Maryland, and the work that she does there. Dr. Josh Sharfstein, the Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins School of Public Health. Our conversations today dealt with COVID-19. I know we haven't answered all of your questions, but I thank you for joining us, and please stay safe, everyone. We're going to get this we're going to get beyond COVID-19, but it's going to take all of us working together to get there. So thank you and stay safe.